CTAD Clinic. My name is Dr. Mike Lloyd and I'm the Clinic Director. And today I'm going to be discussing one of the issues that gets raised in therapy a lot. So again, this is one of those videos that is most useful being considered or maybe being applied in the context of being in therapy with someone who is experienced in this field, is about trying to develop the internal communication with parts or alters, either in systems of DID or OSDD. So the reason for this is that the stabilisation phase of the trauma treatment model is critical, and being able to develop good quality communication internally is a major part of being able to understand why and how dissociation persists even after the trauma has long finished. The difficulty though is that parts or alters often don't communicate, so even when a person has developed the confidence to want to start communicating, they get nothing in return. And that can put people off, it can frustrate people, it can make them feel as if they're not doing good enough, and that's simply not the case because there are many reasons why this communication does not take place. To think about some of the reasons for this, it's important to understand what the purpose of having alters is within these DID or OSDD systems. They're there to hold the trauma, and I've discussed this in some of the other videos on the channel, that where an alter is required through the process of trauma to hold on to that painful memory, the experience or the narrative of what's taken place and hold it away from the person, this is something that they can be doing for many, many years. Often the person who is being protected by this may not realise that the alters are even present. They just don't know. So without being disrespectful, there's a lack of appreciation of the parts of the jobs that they're doing. And the previous video I did describes a little bit about these jobs and these roles. So where a person doesn't know that the alters have been holding on to these trauma memories or the pain and the suffering that they've been through, they don't know to reach out and say thank you. So there's an absence of that connection between the person and between the alters that are holding the trauma. That's largely the purpose of dissociation in the first place, so it's unsurprising that this is what gets played out time and time again, year after year. We then as therapists try and encourage people to develop that internal communication. The person says yes, they have a go, they put a message out, they say hello, they say I'd like to get to know you, I'd like to understand who you are, they get nothing in return. It might be that the alters don't hear, or the alters are hearing, they're looking back at the person, they're going, I want nothing to do with you because you've not helped me for so many years. It might seem a bit odd, but alters can feel unappreciated. They can feel that they're unwanted or they've been pushed away, largely because that's exactly what has been happening. If they hold the trauma, the person can't contain and hold that trauma themselves, they push the trauma away, they push the alters away, the alters feel unappreciated. The person then says, I want to get to know you, I want to be your friend, and the alter's like, I have no interest in this whatsoever, you're not my friend. This is very common, and in clinical settings people try very hard to send messages out internally and they get no response. Sometimes they give up, sometimes they get frustrated, sometimes they just say, fine, if you don't want to know, I want to get rid of the whole lot of you. That's counterproductive. As therapists, what we then start saying is be patient, right? This process, which I call checking in, is a very, very important part of stabilisation. It's really key that you're able to reach out and just say internally, how are you doing? Are you okay? Are you there? I'm willing to try and connect. I want to get to know you. Is there anything that you need that I may be able to provide? These are all really powerful messages that you might send out and get nothing in return. So one of the ways that I describe this is like sending messages out from NASA into deep space, is that we send the messages out, you don't know whether they're ever going to get heard, but you send them anyway because you are hopeful. So this is very much about trying to develop a hopeful message that the person is saying internally, I want to get to know you. I know that you are there, I can feel you, I can hear you, I can sense that my behaviour is shifting, and I want to be able to try and connect. I want to see if there's anything I can do that would help. One way of doing this is to leave a virtual message. So you could say the person could scribble a note down inside their mind and leave it on a gate post or a fence post or on a door, somewhere where it might get picked up, and the note only has to say, hi, this is who I am, I'm interested in getting to know you, just wanted to check in and see if you're okay. This works really well for parts and alters within systems that are well established. So if you haven't heard from an alter for a while, you can just check in, you can say, how you doing? What's going on? Haven't heard from you for ages, I want to make sure you're okay, is there anything you need? If this is the start of communication, this is a great way of being able to start doing it. It can take ages, it can be very frustrating, and it can sometimes not be very rewarding, but it is an important process to go through. And I think if the intent is good, if you genuinely want to connect and you want to help, then I think that message ultimately will start winning the day. But there is a warning attached to this, is sort of be careful what you wish for in a way. What I mean by this is that sometimes that connection can occur very, very quickly. You can say, right, one day I need to start connecting with my alters. You send a message out to say, hi, I'd like to get to know you, and you get immediate response. And sometimes that immediate response can be overwhelming. And I have spoken to people clinically where they've got that reply and it has terrified them. They weren't expecting it. Or sometimes the reply means that it is true that you have DID or OSDD and you kind of wished you hadn't, because it's not a great condition to have. So to have that recognition of the reality of it, to hear a response in return can be very, very scary. And sometimes that makes people back off immediately. So they get the reply and then they just close the door and they say, I can't do this, it's too much, it's overwhelming. Or what can happen is that that reply comes, but it comes with trauma memory or trauma emotion. And again, that can be overwhelming. So you reach out to connect just to say hello. And in return, what you get is trauma memories, you get flashbacks, you might get overwhelmed with sensations, things that have happened a long, long time ago that are suddenly coming back in. Very powerful, very overwhelming, can scare people, and again, make them want to push away and reject any more communication. So this is why doing it with help and assistance and therapy is careful to just try and do it in small amounts. Only what you can cope with, only what can be dealt with at the time. It is a very important process. It can be very frustrating. It's enormously rewarding when it works. And if you're able to develop this internal communication, this process of checking in every now and then, just like, oh, haven't heard from you a while, or there's something going on I need to tell you about, I need to do some signposting, I need to let you know what's coming up. It's really great to be able to do that within these DID and OSDD systems, because it paves the way for that trauma work. Ultimately, without this communication taking place, the trauma exploration part of this treatment model is so much more difficult, and it's very, very unlikely to succeed unless you've got all of these things in place. I hope that's been helpful to you. It is just a process, it's a technique based on trying to overcome a barrier, overcome that dissociative barrier that takes place within trauma to keep you away from the trauma. And these are all the intricate and subtle processes that surround that. So this technique is designed to try and help people begin that process of building a connection, building a bridge between yourself and your internal parts and your trauma in a safe and measured way. I hope it's been helpful. Please leave any comments as before on the channel, and please like and subscribe if you'd like to be informed about future content, and hopefully I will produce more very soon. In the meantime, take great care.